Good evening, everybody. Question, how many people here filled out the survey? Good, okay, excellent, good. And hopefully you found it fairly easy to do, which is great, good. Could we get the first slide there, Anthony, if you don't mind? These are the results. So we have in Halton, we actually have one of the largest chapters of CARP. And about 6,000, a little bit over 6,000 members. We had responses from 763, which is really, really good from a statistical perspective in terms of response. Works out to about 12.7%. And you can see the breakdown there in terms of where the results came from. There is not a chapter for her CARP in Hamilton. So we do send out our newsletters to Hamilton, and they did participate in the survey as well. So that's why you see the Hamilton results up there. Okay, so what we did was we asked what are the most important issues for you to prioritize for us to work for? And we listed, I think there was 11 or 12 altogether. You'll see them up there: affordable housing, vaccines, drug plans, aging at home, frauds and scams, old age security and Canada pension, healthcare wait times, long-term care availability, and RIFs, and specifically about RIF withdrawals. And overwhelmingly, the results were, the top three were healthcare wait times, aging at home, and long-term care availability. They were, and you'll see the numbers in a minute. They're pretty dramatic. Okay, so as you see there, healthcare wait times, and this was the actual wording. So this is what we asked. Healthcare wait times, investment in physicians, specialists in technology, strongly agree, 71.6%. Yeah. Aging at home, incentives, regulations, targeting improved home care and caregiver supports, 68.9. And long-term care availability, standards and incentives, 68.3. So very, very high numbers, very high numbers. Okay, this is the way that the results actually came across. The other top two, so wait times were number one, aging at home number two, long-term care number three, vaccines came in as the number 4 issue. And number 5 was concerns around old age security and Canada pension. And we'll talk a little bit more about that a little bit later in the presentation. So there was also an opportunity, and hopefully those of you that did fill it out, to, what are your comments? Like what do you want to add to it? Give people a chance to get their oar in the water. So really good results. 243 added comments, so almost 1 in 3 added a comment to the results. And the at-home aging received the most comments. There was 23 of those. Now, what was very interesting was we didn't ask about income tax, but that came through as the next most important thing. Some of the other issues that were mentioned would be, driver's tests as you get older, dental care, transportation, medically assisted death came up, dealing with technology, the RIF issue, and this was very concerning. A lot of people talking about being very, very lonely. That was very, very concerning to read. So you'll see up there, this is just, literally, I just captured some of the comments of what people said. So the aging at home, make it easier for people to qualify for Wheel-Trans, support the family caregiver to assist with the care of the family member. The next one was very interesting. This came up frequently, and I think it's one thing that, might be something you might want to talk to some of the local politicians about. Is there an opportunity to reduce property tax so you can back to staying at home? Is there, well, you know what, if we got to be there, we can make it a little bit cheaper. Utility bills, can we set that up that they become tax deductible? Increase home care availability for senior retirees, allow seniors to be able to afford living in their own home, reduce property taxes again, more care for the elderly to stay in their own home rather than long-term care facilities. I think we missed one there, Anthony. Let's go back for a sec. Yeah, so this is the tax issue. So this is where it came up. So reduce income tax on seniors below a set limit. Rich CEOs do not need tax breaks. No tax for low-income seniors, especially those living in subsidized housing. Tax-free CPP, OAS, and again, here's back to the taxes. Lowering of municipal taxes for seniors living in their own homes. Single seniors tax credit adjustments. This came up actually quite a few times. Why do singles get less of a tax break? This discriminates based on marital status. And reduce taxes for all seniors regardless of work status. Okay. Okay, this is a lot of information. Oh, what did I do here? Coming through? I don't know. Oh, there, it's got it. Thank you. This is some of the really, really good work that Anthony and his team have done, pulled together at the National. Ontario is facing the steepest demographic shift in its history. So the 75 plus is the fastest growing age group. It will grow by 30% over the next 10 years. So just from 2021 to this year, there has been a 350% or 350,000 increase, which represents 32% increase just in the last 5 years alone. And then if you look at the numbers going forward, 1.7 in 2030, 2 million by 2035. And this, obviously 75 plus is the largest cohort that are using ERs, that are having surgeries, that are dealing with chronic disease, that have home care needs, and are going into long-term care. And the bottom line is that the current system simply can't absorb it. It's just not feasible. Just not feasible. If you look at the next age group down, which is 65 plus, 73% have at least one chronic condition, and 43% have two or more. Falls. 1 senior in 4 fall every year. And for those that are hospitalized, 1 in 3 never go home. They go into a long-term care facility. Dementia. Fastest growing and most expensive care need in Ontario. So again, this year, there's about 300,000 people. By 2030, that will increase by 66%, up to 500,000, and it's going to double by 2050. Scary stuff. Long-term care. So right now, the province has 138,000 long-term care beds. The wait list is 48,000. The projected need by 2040 is 260,000. Now, the province has committed that they will build or make available 30,000 more beds by 2028. Well, guess what? That's only 62% of the projected need. And what's causing that? Well, there's a variety of stuff. Obviously, COVID kind of got in the way of that. A lot of building delays, huge construction costs associated with that. Again, the aging population, demographic. I want to talk about the staff shortages in a minute. I'll talk about it more in a minute. But the big issue there that you're getting is that, back to what's happening, a lot of immigration cutbacks. Well, guess what? A lot of personal support workers, nursing aides, guess what? They're immigrants. That's where they come from. So that's what's creating part of the problem as well. Okay, these numbers are a little different. These are actually Canadian numbers. So this is a group, it's called the Canadian Institute for Health Information. And I apologize to Chuck because I got his name backwards. His name is Chuck Anderson, not Anderson Chuck. These numbers are mind-boggling, absolutely mind-boggling. In 2025, there was $400 billion spent on healthcare in Canada. Now, that number represented a $16 billion increase over 2024. In 2024, it actually went up 6.5%. But when you take into account inflation, population growth, and aging parents, you actually get, here, look, if you look at the breakdown there. So in 2024, inflation was 4.9%. The population growth was 3%. Aging population represented 0.6. So in real dollars, it actually shrank by 2%. Shrank by 2%. The highest spending categories are hospitals at 26, physicians at 13, and drugs at 13.3. Now, when you look at it though, 50% of the hospital spending is wages. Back to the labor shortage issue. You know, there just aren't the bodies there to get it. So 13%, labor shortages represented 13% of that increase. Because more often than not, what happens is, if they can't get bodies, what do? They go to an agency. Well, the agency's charging them probably double what they would if they had their own staff. So, 6.5 million Canadians don't have a doctor. That's 1 in 5. 1 in 5 do not have a primary health provider. So, you know, as Mr. Anderson says very succinctly, the solution is not more spending. It's innovating how we resource and how we deliver healthcare. Okay, so, well, what can we do about it? And this is kind of the things that CARP's identified as things that we can look at as priority actions in the province. Prioritize wellness and prevention as a core strategy. How many were here and heard Sean Fletch? Everybody remember Sean Fletch? And if you recall what he talked about, you know, back to the whole thing about, you know, 1 in 4 with the falls. Remember he had us doing the balancing, right? And he had the getting up and out of the chairs. Pretty important stuff, right? And to the extent that we can get that kind of thing happening more, it kind of keeps people from doing the slips and falls, right? Building an aging at home first system, obviously, that's what everybody's asking for. Well, guess what? I guess that's what we're going to have to do. And what does that mean? Well, it means expanding workforce capacity. So it's more, you know, personal support workers, nurses, geriatricians, recreation workers, and home health care teams. Creating incentives to go into geriatric medicine. There aren't incentives for now. If somebody wants to become an MD, there isn't an incentive to go into geriatrics, so we should try and do that. High school career choices. The kids are just, get into technology, get into technology, get into technology. Computers is it, the future's it. Got to change that message. The message has got to be, you know what, it's a very good career to be in a helping profession, you know, the social services and getting into more healthcare stuff. People may not be familiar with this one. Behavioral Supports Ontario, I didn't know anything about this, but they do some exceptionally good work. This is a division of the Ontario government that's very much focused on the whole dementia side of things. And to the extent that a lot of what they do is it's very much evidence-based, experience-based, so it's really good stuff that's coming out of there. And I think they need as much help as they can in terms of trying to develop that core curriculum development. So that's another step. Long-term care wages at and close to the hospitals. So there was a real issue, and I think there is some attempt to try and address it, that a lot of the staff that work in a long-term care facility, you know, particularly the nurses, aides, et cetera, there was a wage disparity. And the province has, I think, worked to try and address that and try to increase the wages, but there are a lot of other staff that are also impacted by that, and like, you know, people like recreation workers, you know, et cetera, that there needs to be a little bit more attention to that. And then, of course, just strengthening the whole long-term planning process. Okay, so Anthony and his team, we had an excellent day at Queen's Park. It was a national day of action that was organized back on November the 29th to outline what the issues are with healthcare. All of the Ontario MPPs were invited, and we had actually 45 attend, we were very pleased with that. We met with, so we have in Halton, we actually have 5 MPPs. We met with 3 of them. And we have obviously been doing this meeting tonight. We had a meeting up in Milton last week and communicating the results in the newsletter. So as of now, I have met with 3 of the 5 MPPs, and I'm actually meeting tomorrow with Natalie Pierre, who is our MPP here in Burlington, to kind of walk them through the results of the survey. And then we have also shared the results of the survey with local media, so it was in, and of course, there's no such thing as print media anymore. So it's all of the electronic media in terms of Burlington Today. Oakville has one, Milton has one, Georgetown has one. So we have shared the results of the survey. So anyway, that's kind of where we're at. That's what we've done. That's kind of the story. Those are the things that we plan to do to try and address it. And I'm wondering if anybody has any questions or comments that they would like to ask or share. Yeah. Yep.
But the house insurance, mine has gone up 10%, 2 years ago it was pushing it up 20%. Becomes cost prohibitive for the person who's on a pension. So has there not been any input from our members regarding auto and home insurance?
It did not come up. Did everybody hear the question? No. Yeah, so the question was auto insurance and home insurance. You know, again, a rise in cost and again, another cost of trying to stay at home. Interestingly enough, it's a good point. It did not come up. It wasn't mentioned in any of the comments. So, yeah. But thank you, because you're absolutely right. It's something else that should be added to the list. Yeah. Yeah. Yeah.
At any time, if the shortage of medical staff gets mentioned, especially we have a lot of foreign-trained, highly trained medical staff that are cleaning toilets.
Yep. Here.
I was wondering whether there was something mentioned about trying to speed up or facilitate the induction of foreign-trained medical staff who are highly trained and they're working as PSWs or cleaning toilets because of the policies of the Canadian Medical Association, the Canadian Mental Association, etc. And I think that it would be a good thing for CARP to maybe raise a question like that. What can be done to include these into our system faster and alleviate the shortage?
Yeah, well, fair point. And again, I think part of the problem now is just even getting the folks here now. That's part of the problem because of the cutbacks on immigration. But I understand your point. Yeah, fair point. Yep. No, not already. No, that's fair. That's true. Yeah. Let me come over and get the microphone.
Can you tell me on your demographics, whether it is demographics that you pulled up through the survey or your membership, 6,000 people in Halton and wherever across the country, what percentage of those people are single seniors?
Oh.
How you live and how you pay for things as a single person, and God forbid when you're married and then you are a single person, you find out how badly screwed over you get. I would just like to know what that percentage is.
So it did not, it wasn't a part of the survey, but it came through a lot, as I was mentioning earlier in the comments, that there were several people that mentioned the fact that, you know what, I'm single, and I don't think I'm getting as good a deal as somebody who is in a relationship. That did come through, big time, yes.
Outrageous.
Yes.
And it's terrible when people are married and a spouse dies, and then the remaining spouse, it's terrible when a spouse dies, because this happened to 2 of my friends in 24, and all of a sudden they're single and filing taxes in 2025, the shock nearly killed them.
Yeah.
It's horrible.
Yes, thank you. Thank you very much. Yeah. Anybody? Yeah.
So you don't know the percentage.
We didn't ask for it.
But don't
So-
you have that as part of your membership? Know how many people are single?
I don't, we'd have to ask Keith. I don't know, Keith, what do you think, Roland? Would Keith know something like that? Number of our members that are single? I don't think we've ever tracked that, have we?
I think something that CARP should
Okay, yeah, quite favorable, yeah. It hasn't been done, eh, Roger? Yeah, no. But thank you, thank you.